You are listening to the Horse Radio Network, part of the Equine Network family.
Welcome to this episode of Disease du Jour. I'm your host, Carly Sisson, and in this episode, I spoke with Dr. Stephen O'Grady about thrush in horses. This episode of Disease du Jour is brought to you by Bimeda. Dr. O'Grady was a professional farrier for 10 years prior to obtaining his degree in veterinary medicine. He learned the farrier trade through a formal 3-year apprenticeship under Hall of Fame farrier Joseph M. Pierce of Westchester, Pennsylvania. He then returned to school, attended Haverford College, and went on to graduate from the University of Pretoria Faculty of Veterinary Science in South Africa with a DVM degree in 1981. After graduating from veterinary school, Dr. O'Grady did an equine internship in Cape Town, South Africa. From here, he went on to join Dr. Dan Flynn at the prestigious Georgetown Equine Hospital in Charlottesville, Virginia, where he stayed for 10 years before opening his own practice in Keswick, Virginia, devoted to treating competition horses and farriery. In 2003, he opened Northern Virginia Equine in Marshall, Virginia, and in 2014, he moved back to Keswick, Virginia, and opened Virginia Therapeutic Farriery. Both are referral practices devoted to foot disease and equine therapeutic farriery. Dr. O'Grady combines his skills as a veterinarian and a farrier to better understand and treat problems of the foot. He has published 33 peer-reviewed papers in the veterinary literature, numerous papers in the farrier literature, written 18 book chapters, and edited 2 editions of the Veterinary Clinics of North America on equine podiatry and therapeutic farriery, all resulting from his extensive work in equine podiatry. In 2003, he was inducted into the International Equine Veterinarians Hall of Fame, and in 2009, he received the AAEP President's Award for his work in farrier education. In 2019, he was awarded the coveted gold medal from the South African Veterinary Association. In 2020, he was acknowledged for his commitment to the education of equine practitioners around the world and received the AAEP's Distinguished Educator Award. In 2024, Dr. O'Grady was nominated and voted onto the AAEP Mentor Honor Wall. Welcome to the podcast, Dr. O'Grady. Can you get us started by just explaining a little bit about the anatomy of the horse and why it's important?
Sure. If we look at the hoof capsule is the outer shell or the of the foot with the contents, the bone and everything inside. The hoof capsule is defined as the hoof wall, the sole, the frog, and the bulbs of the heels. And all these parts are interrelated. And if one part of this, in other words, of the hoof capsule, is not healthy or is diseased or distorted, the whole hoof capsule itself it's not healthy. So they all sort of work together. Now, if we look at the frog forms the palmar section of the horse's foot, and it's intimately related with the digital cushion above. You know, it's sort of a symbiotic relationship. What happens to one happens to the other. And we can put up, or I can send you the anatomy of the back of the foot so your listeners, better understand it. Okay. Having said that, the frog and the digital cushion, it's kind of really hard to separate them. Okay. They play a role in supporting the back of the foot. They dissipate the energy of impact when the horse's foot strikes the ground. They act as a shock absorber when the horse's foot's on the ground and you have 1,000 pounds on top of it. They really aid in traction. That's a big part of it. And what people don't understand about the frog, when it's healthy and the right size, the frog actually acts as an expansion joint between the heels of the hoof capsule. So if you start to lose the frog for some reason and it decreases in shape and mass, the digital cushion above also decreases and the heels start to come inwards, okay? And whenever you see a horse with, for example, contracted heels, where the heels have moved in, you will look and you will see a frog that's not healthy, or it's narrow and it doesn't have the mass that's necessary to keep those feet apart. One other thing I wanted to start with before we start, the horse's foot. When the frog is healthy, again, I keep going back to the word healthy. I don't use the word normal because I don't know what normal is. I don't think any of us know what normal is, but it's an individual kind of thing. But we know when a structure is healthy, and when you have a good size normal frog, and the heels of the hoof capsule and the frog are on the same horizontal plane. The horse's foot has a what they call a self-cleaning mechanism. In other words, when the horse puts his foot down, the weight of the horse spreads the frog, and the frog pushes anything that's in the sulci next to the frog out of there, so it keeps it clean. So if you pick up a horse's foot, especially one that say just worked for a while or went for a long walk and come back, and the horse is full of the debris or the manure that is started with the stable, you didn't pick his feet, and he ends up with it, then there's something wrong with the mechanism within the hoof capsule. Okay, does that make sense?
Yeah, that's really interesting. I feel like you don't really hear people think about it that way.
Yeah. And the other thing that it was one of your questions, and we'll come back to it, was you don't see it in the barefoot horse very rarely. And these horses stand in muck and, all kinds of debris. And what happens there is when you take the shoe off the horse's foot wears. It wears by friction. Okay, and it wears all the way around the hoof capsule from heel to heel. Okay, therefore, it keeps the heels and the frog on the same horizontal plane. Therefore, it makes the heel area load sharing. In other words, everybody's taking some of this load. At the same time, the frog is being stimulated. And you need stimulation. You need stimulation. Bone needs stimulation. Everything needs stimulation to be healthy. And it stays on this plane next to the ground. And you rarely see a horse with thrush that is a barefoot horse with thrush. And they stand in muck and they stand in debris and whatever, and it's just a big difference. So in my mind, it comes back to the point that when we see this so often, and it's almost considered to be common in some places, that there is something compared with foot care that has its origin, or thrush has its origin.
So I guess that sort of segues into my next question for you, which is, what is the veterinarian's role in recognizing and managing thrush? Because I think this is something that maybe a horse owner would typically recognize or a farrier would recognize. Maybe the horse owner doesn't call their vet to address the issue. But as you were saying, it's kind of a symptom of a structural flaw a lot of the time. So what would the veterinarian's role be throughout this entire process of recognizing and then managing a horse with thrush?
I spend a good part, and a lot of us spend a good part on lecturing on the importance of looking at the horse's foot and its relationship to horse's health, lameness, etc. And veterinarians, it's not something that really catches their eye unless you have thrush that's going to the point where, you're starting to get blood when you go to clean the foot, or the horse is showing some sensitivity, or it's encroaching on the structures that are close to it, where it may cause some more extensive infection. Veterinarians don't usually get involved. And on the farrier side of it, sure, farriers are very, very adept in recognizing thrush, but there are so many different thoughts, theories, treatment modalities of treating this that instead of going to the cause. And then, of course, now, we have Dr. Google and Professor Facebook and a host of other ones now that this is the first place where horse owners or even professionals will go to, and they'll dial in what they're looking for, and they'll have all kinds of treatment modalities, whether right or wrong, to treat it from. So it becomes actually a very controversial disease. But going back to my first part, remember, if you have a disease structure as part of the hoof capsule, you don't have a healthy hoof. And if you think about the mechanisms the frog is responsible for, then the physiology of that foot is compromised as well.
This podcast is brought to you by Bimeda, the manufacturer of GastroBim. GastroBim, omeprazole, is the first and only FDA-approved bioequivalent to GastroGuard. Give your horse a scientifically proven, apple-flavored solution for gastric ulcers. Because equine gastric ulcer syndrome is complex, always work with your veterinarian for proper diagnosis and care. Same trusted treatment, less cost. That's GastroBim. The safety of GastroBim paste has not been determined in pregnant or lactating mares. For use in horses and foals 4 weeks of age and older. Can you review the etiology of thrush for us? I know we've talked a lot about the structure of the hoof, but what about the actual process of thrush itself?
Sure. There's two things there. Number one, we did a paper in 2020, I think, with the Farrier at Virginia Tech on thrush. It had never been done before. This is a scientific paper. And we started the paper off by noting that you had to make sure that you knew the difference between thrush and canker. And canker is a disease, and believe me, you're seeing a lot more than we used to see it. It's pretty prevalent. Thrush is a degenerative disease. In other words, the infection attacks the epidermal tissue, the tissue of thrush, and it decreases the mass. Whereas canker will go ahead and proliferate. In other words, it become larger and you'll have an abnormal surface on it. In other words, projection over top of it. Okay. When you start to see, most of the time, the first signs of thrush is that the frog will be somewhat below the surface of the hoof capsule. Okay. Therefore, it's not being part of the hoof capsule. It's receded underneath there, so it's not getting the stimulation it needs. Number two, when it doesn't get stimulation, the epidermal covering of the frog becomes a little bit more fragile and it becomes viable to something penetrating it. Number three, as time goes on, the area in there will pack up with, over top of the frog, will pack up with debris, manure, dirt, and everything. It'll put more pressure on a structure that is not as robust and healthy as it was. Okay. A lot of times this is manure or different organisms from the ground. And as you get this pressure that's sitting on the frog, these organisms will start to penetrate into the lining of the frog or the covering of the frog, the epidermis, and then it'll start a low-grade infection where it starts to deteriorate the structures. Does that make sense?
Yeah, so it's not just like the horse is standing around in the mud for a few days and it's going to get thrush. This is a much more complex process where the frog is unhealthy, and then maybe on top of that you have some improper hoof care. Or does hoof care really play a role in this at all?
I think the hoof care plays a major role in this. And if you have a horse, again, with a healthy frog, one that you want to go take a photograph of, boy, this is one for the anatomy book. Boy, this is beautiful. That horse, you can put him in any kind of muck you want, any kind of surroundings, and he is not going to get thrush. Okay, because you have that surface area that is impenetrable because that structure is tough, especially like in a barefoot horse. The more that frog is stimulated, that thicker that epidermis is going to become. So it's going to be a lot more hard to penetrate. And remember that when the frog starts to recede, even a little bit, the more it recedes, those heels start to move in. Okay? And when those heels move in, that the digital cushion is also getting a little narrower as well. So you don't have the surface area there. In other words, you're decreasing the surface area. So you have area that you have more susceptible area because your surface area has been decreased.
Okay. Are there any other risk factors that we haven't touched on?
No, I think we did, We did pretty good. Now, obviously, if you get, a puncture wound in the frog, or, you get a laceration through the frog, or you could get, people talk about the frog being bruised. The frog, if you understand the structure, it's really kind of hard to bruise. It doesn't bruise that well, but you read about the frog being bruised, and from the bruise, you got an infection. But infection has to have entry point, which we all know. Okay, and with thrush, the most logical entry point is when the epidermal covering becomes the horny part becomes more penetratable, and disease can get into it.
Right. I would love to talk about a little bit more about the characteristics of a healthy versus unhealthy frog, and specifically something really interesting that you discussed in your recent paper about the fissure that occurs in an unhealthy frog. I think a lot of people attribute this to a clinical sign of thrush, but you argue that this is rather a structural defect that creates an environment where thrush can form. So can you talk a little bit more about that and what the next step should be for a horse that has a fissure but does not currently have thrush, if that makes sense?
Sure, not a problem. When we see this fissure, it's usually in a horse with what, and I won't argue the case anymore because we got hundreds of cases now in publications or whatever. But so, prove me wrong, and we'll go from there. There's a hoof capsule distortion called sheared heels. And this is a condition where the horse lands asymmetrically. In other words, he'll land on one side of his foot and then come over and load the other side. So he's getting asymmetrical weight bearing on that. Okay. Now, the consequence of this is from the overload when he lands on the inside, he pushes the heel upwards. Hence the word sheared heel. Now, when you go ahead and see this horse and he has a good frog in there, but this type of landing pattern, your heel will be pushed up, but the frog will be intact. Okay, now take the same horse and have a narrow frog or a diseased frog or a frog that's quite receded. When the horse is landing and he's got severe asymmetric landing, okay, you're getting shear forces, one going one way, one going the other way. Therefore, when over time, where's the weakest point of the tissue that is going to crack or break? It's going to be right in the base of the frog. Okay? There's no other stress, your weakest point. There's no other structure on either side of that that can go ahead and break. Once you go ahead and it breaks and it forms this fissure, sometimes it'll go right up into the skin. It can become quite painful because you still have the heels moving,
Right.
but it's an environment for an infection to set up shop or take place. Okay, and it's very hard to deal with. Why? Because if we go back to basic physiology, what keeps a wound from healing? Okay, infection, number one. Number two, movement. So when you have thrush that will set up in this environment, the foot is continually moving. So it makes it very, very hard to treat. And people are going to pack it with different things. They're going to put different medications in there and whatever. Yes, it will dry it up some, but you still have the cause that is causing that. And even if you do dry it up, it's not going to resolve completely, and it's going to go ahead and continue whenever you let your guard down.
Yeah, it always goes back to that structural component.
Yeah, right. Yeah.
So, if a veterinarian is examining a horse that has thrush or that they suspect has thrush, what do you think their complete clinical examination should include, especially with regards to some of these bigger structural issues?
Well, if a veterinarian approaches a horse and he sees that he has thrush and he has an infection in the fissure, and especially it's probably going to go up into the hair. Sometimes it'll even into the hair, into the skin. Sometimes it'll even bleed because of the movement there. So obviously that's why he's going to be called. So when a veterinarian would see this, number one, I feel that he would be, what is the cause of this? Okay, why is this happening? Number two, what are the causative factors? the abnormal, landing pattern, and the frog that is not up to par, that is not the disease that allowed this to start. It's what we should have said in the very beginning. You do not see thrush in a normal, or there I go, normal, or a good, healthy frog.
Right.
You just don't see it. And you can stand them in anything you want, but you have to have some kind of compromise here.
Right. And probably has been for a while by the time the vet is called out for
Yes.
likely a more severe case.
Yes. We're in the middle of writing a paper now that for what we call physiological horseshoeing. It's for vets and farriers to look at the foot, look at the components of it. Okay. And here's what it should look like. Here's what it can look like.
How would the vet then go about implementing treatment for the horse, and both medically and farriery related?
Okay, I have found, well, medically wise, obviously he would advise how to keep it clean. You would probably soak it. You would apply some kind of medication there along with packing it if you had a fissure there, or alongside the frog if you could, keeping the horse's environment clean, that sort of thing. But again, that's palliative in a way, because you still have a cause. And in farriery, the first thing we look at is, where is the position of the frog? Okay, where is it located in the back of the foot? Is it markedly below the level of the heels? If it is, then something needs to be done about it. If it's prolapsed down below the heels, then something needs to be done about it. So those are the two things that he would be looking at farriery wise. Then the next step, obviously, if he didn't do it himself, would be to call the farrier or meet up with him, or suggest, hey, we need to go ahead and address this. Now, for a long time, when we saw these sheared heels, and I have publications going back years on sheared heels, our first fix was to stabilize those heels. In other words, with a bar shoe or something. In other words, to stop the movement, that kind of thing. And it certainly did help, but it really didn't have the ability to restore those structures to a better shape or better health than we could. So recently, well, for the last few years, we have recommended now we're talking about with severe thrush. Let's go back a little bit, if the thrush is moderate, if it's not receded too much, it's not real narrow, then just getting the heels down of the hoof capsule with farriery till they're on the same horizontal plane is going to make a world of difference in that horse. Okay. And then your treatment is going to put you over the edge. If it's severe, what we found, our best remedy for it is to take those horses' shoes off for a period of time, let them go barefoot. Okay? And just let the weight of the horse will change the conformation of the heels. It will wear the bottom of the foot in a sort of a level plane all the way around by friction. And very shortly, you'll see that frog just go ahead and clear up, because it gets stronger and healthier.
Yeah, that's fascinating.
Yeah.
Do you ever recommend balance films on some of these horses that have unhealthy frogs to help inform the farriery process? Or do you think that you can do this a little bit more just visually?
Well, and what I do, we want radiographs on most everything that I'm called to see, and the balance films or podiatry study will go ahead, and it can give you a lot of indications as to the distortion is present. But with thrush being present, you will see it on the radiograph if you know how to interpret that part, but you could also see it grossly. And a lot of times you can see the hoof capsule distortion and the disease within the frog without having to resort to radiographs.
Yeah, that's a great tip. I'd like to talk a little bit more about how the vet can collaborate with the horse's farrier to start to address this issue. I know that you co-authored a paper on the subject, and it can be tricky. Do you have any pieces of advice for veterinarians on collaborating with the horse's farrier when you're managing a thrush case like this?
Most farriers and veterinarians, well, there are some veterinarians who have been doing it a long time and figure, well, this is the way I do it, and this is how I'm always going to do it, and tell the farrier, here's what I want him to do or whatever. The vet farrier relationship could certainly use some improvement, could be improved, can always be improved.
Yeah.
One of the things that we forget to do or leave out of it is discussion. Number two, respecting each other. That we both are bringing our skills and our profession to the table. And number three, sometimes we need to leave our egos at the door, myself included. And the fourth thing is that we really forget is that we're working for the horse. This is all for the betterment of the horse, to help the horse. Forget about us. So when farriers get together, vets and farriers get together and they communicate, you wouldn't believe what can be accomplished. When you have a discussion rather than on the back of an old lunch pail, and perhaps the veterinarian would say, hey, would you like radiographs? So the farrier would say, hey, would you mind radiographing so I can see whether, I can drop this side more or whatever. This is where it comes together and it's really beneficial. And I have the fortune to work with a lot of good farriers, and I don't think it's very rarely that I walk away without learning something. And I hope in some small way it's the other way around. But this is an area that could be improved. And to go a little bit further is that a lot of farriers, they depends on how long they've been working and their skill level, what they're bringing to the table. Be fair, on the other side, the amount of farriery that is taught in veterinary school is appalling.
Right.
Okay? Because, you have so much material to put into 4 years. Farriery plays a very small part of it. Leave that to the farrier. We're here for, joints and that kind of thing. Where I really think there more time needs to be spent with farrier and vet schools. And if you look at, there's 4 or 5 good papers out that states that over 60% of front limb lameness is related to the foot or is caused by the foot or related to the foot, with the digit above. So, that's huge. So look at the role farrier plays in here. And if you don't have, for example, if you had a horse with a low heel, obviously he's going to damage that frog, quite significantly, or a club foot where he's going to have a frog receded. That foot doesn't have the ability to dissipate the energy of impact. Therefore, look at the position or look at the influence on the joints, on the bones, on the ligaments, everything. So it's all interconnected.
Yeah, and I'm going to link that paper in the show notes for anyone who wants to read it because I think there was some really great advice in there. But I really loved that about how a lot of farriers are just really great horse people in general, and they're a great ally to have on your team when you're managing these cases. Also, I think a lot of times farriers are seeing the horse a lot more often than the vet because they're there every few weeks. So yeah, I definitely agree. I think it's a great professional relationship to establish.
A while back, I did a Google search. I think it was around the time of the paper, for the paper, a Google search on treatment of thrush. And I forget, I don't know how many hits I got, 3,000 some odd hits on the treatment of thrush on Google. And there's a lot of validity to some of them. There's a lot of good products out there. But if you don't take the cause away, then these products are not going to be that effective.
Yeah, they're a Band-Aid.
Yeah, and it's one of the reasons we wrote that paper because nobody really looked into this. Thrush. We all have thrush. No, there's a reason why you have thrush.
Yeah. Is there anything else you'd like to add? Anything that we didn't touch on yet about thrush in this episode?
Again, you don't find thrush in a healthy foot. or a healthy frog, okay, or a good robust frog. Therefore, there has to be a mechanism to where that frog starts to lose mass, starts to deteriorate, where it can go ahead and acquire thrush. So there's a cause behind thrush. And it's not keeping your stall clean or how many times you can soak the horse's foot or put iodine in there or whatever. If you have a small ribbon thin frog that is quite receded down within the hoof capsule, this diseased, it is not going to heal in that environment sitting down in the hoof capsule. You have to do something about it. Another thing that's kind of interesting is that we hear an awful lot about frog pressure these days. And frog pressure can be very useful, and it can be very helpful to add that little stimulation to the frog where you make the frog and the hoof wall load sharing in the heel section of the foot. But you can also apply frog pressure to a diseased or a frog without a lot of mass, or a frog that's receded with some impression material in a bar or whatever. All you're doing here is putting more pressure on a structure, and you're diseasing it more. It's doing nothing as far as helping the load mechanism in the back of the horse's foot.
Yeah. Well, I think that's a great take home from this episode. And if you notice thrush in your horse, then maybe that's a sign that you should take a look at their overall hoof health a little bit more.
Well, I mean, the health of the foot. Remember, if you had a big deficit in the hoof wall in the toe area, that's not a healthy foot. The rest of it could be. The same way, you have a thin sole. Okay, well, the rest of it is pretty robust. You still don't have a healthy foot because you have one component of the hoof capsule that is not as healthy as it should be. So it's a whole entity.
Yeah.
It's all interrelated.
For sure.
And you got to remember the function of it, how it works, and how important it is to the horse's foot and the health.
Yeah. Well, thank you so much, Dr. O'Grady, for joining us on this episode. I really enjoyed talking to you about thrush.
You're very welcome.
I would like to say thank you again to Dr. O'Grady for joining us, and thank you to Bimeda for supporting this episode. And as always, thank you to all of our listeners for tuning in to Disease du Jour. If you have questions or suggestions for the podcast, please send me an email at csisson@equinenetwork.com.